we have heard about a treatment called Tavi.
Right.
What is it and what kind of valves it cures?
Okay. So Tavi is basically in full form in transcutaneous aortic valve implantation. The gold standard treatment of aortic valve stenosis since a long time has been surgical. That means you send him to a surgeon. Surgeon is going to open the chest, open the heart and replace this valve with a new valve which is either metallic or a tissue valve. So the valve actually looks like this even in surgical. This is the Tavi valve, but in the surgery also it looks like that. So why did Tavi come in? Why did the need for putting a valve without surgery came in? So it's happened such that there were patients who were 70s and 80s who had, in addition to heart disease, they had lung diseases, they had liver diseases, they had bad general condition, and the surgeons would say, I'm not going to touch this patient because if I operate him, his risk of dying is very high. So such patients were left to be, so that it was signed that your fate is sealed. We can't do surgery and medicine is not an option. So in early 90s, the scientists said, why don't we try valves that can go in without surgery? Then the research started. So the first valve replacement happened in the year 2002, where a French doctor implanted the valve from the groin. The groin is here. He went across into the heart and put a valve with a balloon in the aortic position. And that patient survived long enough. So that started this exploration or explosion of this Tavi therapy. And doctors and patients started realizing that there could be options that can save their lives, which otherwise was not possible.
Yeah.
And this has now progressed to such an extent. So as of 2023, which we are in now, we can also do these procedures in patients who are not high risk or who can't be operated. So now we are providing an alternative to surgery, even to patients who can undergo surgery. So that's the evolution of this valve process that has happened.